Hello, Scottsdale moms. My name is Kate Eschbach, and I'm so glad that you're tuning in for a special interview today with Dr. Vanatta. Today, we're talking about anxiety in children, and Dr. Vanatta is going to be answering some of our readers' most frequently asked audience questions. So, Dr. Vanatta, thank you so much for being with us today.
Of course, it's a great topic. Very, very important.
Very important. Well, before we get started, will you tell us just a little bit about your practice and where you are, where you're located?
Yeah, so I work at Phoenix Children's Pediatrics in our Scottsdale location. We are at 56th Street in Bell. It's not too far away from some of our other clinics. As you know, Phoenix Children's Pediatrics, we have so many clinics across the valley, which is awesome. And yeah, so we're one of them, like I said, 56th Street and Bell, the Scottsdale location. And at my clinic, it's just Dr. Lisa Pepka and I.
That's wonderful. So easy to find if they want to find you and make an appointment with you. So, all right, so let's jump in. So, what are the best strategies to help calm an anxious child?
So I think that this is a very important question. I get this a lot from my parents every single day in clinic because, as you know, anxiety is so common in childhood. And so one of the things that I always like to tell my families, honestly, from the time that they're really little even, is before they even would have anxiety, right, is I want them to always talk to their children about their feelings. So a lot of times kids don't really know what anxiety is. So I always say, like, okay, in the very beginning, like even like 1 to 2 years old, you should always talk about like what anxiety is. It's your worries and your fears. And so, and then the other thing that I do is because like it's really hard to calm your child when they're so upset, right? So that's like not really the time to like calm your child, but I like to develop strategies when they are calm to then help them when they're anxious. So one of the things that I do is I tell them when you're not calm, when the kids are in their safe space, whether that's their bedroom, their backyard, sitting in their kitchen with their dog, those kind of things, that's when we're going to practice our deep breathing. So I have them sit there and then just take deep breaths in, deep breaths out, and it's really to teach them those skills to then do when they're anxious. So for example, if you're, eating breakfast, whatever, and you're like, okay, great, let's do our mindfulness, let's do our breathing. And then later on in the day, they are really anxious. They're like, I don't want to go to school. Like, I'm so scared of school. Then you're like, okay, let's pause. Do you remember when we were sitting at the table eating your favorite breakfast? What those deep breathing exercises that we did? And they're like, yeah. And then, I mean, in a real world, like sometimes it doesn't work, but we try to focus on those breathing exercises. So I think breathing is really important. Okay, so that's one thing that I would do for an anxious child in that moment is to try to breathe. The other things that you can do and when your child is super anxious is, again, when they're not calm, create like a worry jar or something like that. Something where they can put those worries. So if they're not at the developmental stage where they can sit there and breathe, then it's like, okay, great. Like, let's put it in a ball and then let's put it all in a jar. So those are other things too. And then really developing healthy habits. I'm a pediatrician. I love my healthy habits. So first things, diet, right? So eating your fruits and vegetables, which all kids love. And so I have them do that. And then we talk about exercise. Exercise is really good. I need a child to be at least active for 1 hour a day. And then other things being sleep. Sleep is going to be so, so, so important. And it's funny because I have like a question that I ask all families during a well child check of how many hours of sleep does your child get? 9 times out of 10, they all put 8 because I think that they think that that's the magic number.
Right, that's the right answer.
Yeah, it's like 8 hours. And I'm like, no. So children really need like 9 to 11 hours of sleep at night. So sleep is so important in doing those routines. So I think, like I said, as far as how to manage a calm child, I think developing these strategies before we get anxious is really important. So then when we are anxious, we can then use these strategies. And I have seen my nieces, one of them is now 4, but since she was like 2 or 3, she was able to be like,
And so it makes me want to take a deep breath, like, okay, okay.
And she'll be like, I need to breathe. And I'm like, you're
Oh,
right. You do need to breathe. And not trying to promote screen time here or anything, but I'm telling you, Daniel Tiger, I am a big fan. He
we are
really,
too in this house. That's one of my favorites for sure.
it really is. And I think that it teaches kids that it's okay to be anxious, it's okay to be fearful. You have these emotions, but like, let's talk about them and let's figure out what to do with them. And I
Yeah,
think this honestly goes on to like adolescents too. Like this isn't just for like little kids. This is for big kids too.
absolutely. Just getting them to verbalize what it is that they are anxious about sometimes is half the battle, because they're not even sure. They have these feelings, but they're not even sure, well, it's a test coming. Oh, okay, so let's talk about this. Yeah. And I love that practicing before they're already in that moment where
Right.
their brain is somewhere else. It's like,
Yes.
let's practice while it's calm. And so you build those strategies. I love that. That's great advice.
And I think that that's very similar even for adults. So like I always tell parents too, it's really important for you to practice what you're teaching
Yes.
to the kid as well. And so if you practice with them too, and then when you're anxious about something, then you'll be able to take those deep breaths and work with it. And then by you doing it, then your child sees that you can do it. And so
Yep.
it's helpful all around.
It's like we teach them everything, brushing their teeth, everything else. And we need to teach them
Mm-hmm.
how to be calm in a situation as well. And I think as parents, when we share that we worry about things too, like
Mm-hmm.
we worry about, oh my goodness, we have a lot of family coming over for whatever holiday, and we're nervous that maybe the house needs to be cleaner or the food needs to be nice. I think as parents, we try and hide all those things from our kids, but I think it's
Mm-hmm.
good for them to walk through it with us and to understand, oh, it's okay to be worried. Mom and dad worry too. This is how they handle it.
And I
Yeah.
think it's always important that if a kid is having a breakdown, if they're super anxious about it, to validate their anxiety as well. So I see that you're anxious about this and not just like, no, just go do it. Because by doing that, it's going to actually make it worse for them rather than, saying, hey, like, I see that you're anxious. Tell me about your anxiety. And then, hey, what you're doing is enough. So always positive praising them, because when you do that negative talk to them, it makes the situation sometimes worse.
Yeah. Yeah, because then they're just compounding on top of all the feelings.
Mhm.
Now I'm anxious and I've let my parents down. So it's
Right.
yeah, exactly. Oh, I love it. I love it. How do you know when you should seek out help?
So this is a really good question, and this is something that I see a lot in my practice as well. So one of the things I recently did this course, it's called Reach, and it's essentially a mini fellowship for mental health. And it was a fantastic course. It was weekend long, and then now once a week, once every other week, I meet with this group and we continue the education. So mental health is something that I'm extremely passionate about. So, but through that course, it taught us a lot of things as well. And one of the things that I wasn't doing at my practice is I always screened for depression, but we really didn't have a screening tool for anxiety that we used on every visit.
Mm.
So now I've learned that there's a screening tool called the Scared, and it's great. You can use it honestly in toddlers, elementary school, high school. And it really does then allow the parents can fill it out and then the child can fill it out when they're a little bit older. And it really does show like what is the normal and what's not the normal. But say you don't have this screening tool, right? I always say, so everyone's going to have a little bit of anxiety, but actually up to 8% of kids actually have severe anxiety that need to be treated. So what are those symptoms? So if it is impacting their day-to-day life, you need to get help with it. So if they're continuously, for example, in the morning time, they're like, oh, I can't go to school, and then they're missing summer school. That's something that you definitely need to seek help about. If they're starting to have like recurrent complaints, for example, like every single day we have a headache, every single day we have a bellyache, those are things that we need to address with our pediatrician and figure out like how we can help the kiddo. The other thing is like if they're not concentrating in school, so their grades are dropping, or they're not concentrating, they can't do their sport that they were doing. Those things we need to seek help on. And then if they're not sleeping, so a lot of times kiddos with anxiety won't sleep. So they'll just have racing thoughts in their head and they won't be able to sleep. And those things, when it's actually impairing your day-to-day function, that's when you really need to seek help from a provider or from, from anyone who you can find resources to help you.
Great advice. That's great. Um, and this is a good one. Should you go to a doctor or a therapist when you start to seek out help?
So I think this is also a really important question. So one of the things that I've learned is assessment is so important. So a child who is having anxiety, it likely could be anxiety, just anxiety, right? But there are so many different medical conditions as well that can initially present as anxiety. And so that's why I do think that it's really important if you think that your child is having anxiety to go to your pediatrician first. And so, for example, like your thyroid, if it's too high, you can have a lot of anxiety. If your child's drinking too much coffee, which I really hope none of my patients are drinking caffeine and coffee, but it's okay. I wasn't born yesterday. But those things can come out like that. Migraine headaches can come out as that. Asthma, like if someone's feeling like shortness of breath and the mom, dad are just like, oh, it's
Oh,
probably your
right.
anxiety.
Yeah.
So again, like that's what I'm trained for, right? Like I'm trained to see like what is anxiety, what's not anxiety. And then going even forward with that is there's a lot of things within mental health itself, within psychiatry itself, that anxiety, ADHD can look like anxiety, depression can look like anxiety, learning disorders
Yep.
very commonly present initially as anxiety. So these are all things that going to your pediatrician and being able to have this discussion with, and then they're trained to ask you the right questions to then be able to then, yes, like this is anxiety or no, it's not. And then yes, 100%. And going to therapy. So this is a study that I always tell my patients. So it's like my favorite study out there. It's the CAM study. Okay. So child adolescent anxiety multimodal study, I think is what it is. So they randomly assigned children and adolescents ages like 7 to 17, I believe, 4 groups. So the first group being medication and therapy, second group being medication alone, third group being therapy alone, and then a placebo. So when they did this entire study, they showed that medication and therapy is always going to be the best treatment. Okay. So those people I want to say had around like an 80% recovery rate. But actually
Wow.
the second best group for anxiety, okay, was therapy alone. Okay. And the third one was medication alone and then followed by placebo. So, I mean, a take home message from this is that therapy counseling really does make a huge difference with kids with anxiety. Um,
Absolutely.
and yes, medication obviously is the top one with therapy, but I always like to key in like, hey, that therapy is so, so important. So those are like the main things that I kind of go over as far as like, yes, go to your pediatrician. They will help you figure out kind of what's going on. And then from there, like, especially me, I will guide you in the direction that you need to go.
I love what you shared because as a parent of 5, I can say that one of my kiddos, their learning disability presented as anxiety first. And so, because they were too young for that to really be assessed yet, what was happening is they just knew they were falling behind their peers. And so they were
Mhm.
becoming anxious. And then the therapy, I'm a huge believer in they've got to talk through what's going on and really get that filed wherever it needs to go and work it out. Um, Therapy for our family has been, and I still find that there is a stigma around therapy. And I tell every parent that'll listen, no, go, one of my kiddos, they only needed therapy for about 6 months. And it was a huge, huge change. And then one of my kiddos has been in therapy since they were 4. And we go
Mhm.
every week and the therapist is almost a part of our family, we just go
Yeah.
go talk and it makes the day after therapy is a good day. It's a good day.
is, and I think it's hard because, you have some parents that are really like, I want a medication to fix this and that's it. And
Sure.
then you do have some parents that are like, I don't want any medicine. I just want this. So I do get all ranges of it. And that's why I think the important part is following the evidence as well. And that's
Yeah.
why I love that CAM study, because I'm not just, making things up from personal experience. I'm not, you
Sure.
know, and it's really following the literature on it. And yeah, I agree. Therapy is the best. And it is, and this is what I always tell my families as well, is with therapy, the first therapist that you have might not be your therapist.
Why
Okay.
not? It's so
So,
true.
and the second one might not be either, but don't give up. Don't give up, because you will find one that fits and is
Yes.
great and is going to make the biggest difference.
It
But
really is like trying on a coat. The first one might not be the one that you're going to stick with, but
right.
they're out there and it's worth finding the right coat. It is.
It definitely is. And I think honestly, my patients who have found that perfect therapist, you can just tell
Yes,
how what a difference it makes.
it's true. It's true. And I feel like it doesn't even just change the patient, it'll change the whole family.
Mhm.
The whole family, you don't even realize that of course, it impacts family dynamics. And once
Yeah.
you find that right fit and the kiddo that is suffering with anxiety starts to learn the strategies to work on it, the whole family dynamic gets calmer. The whole
Mhm.
family, the household starts to look different and function differently, which is a good thing.
And one of the other things too is super important is that anxiety is usually genetic. Like, it's something that's within families. So if your child has anxiety, maybe mom and dad have anxiety too, and it can help everyone. And that's
Yeah,
probably why it does change the family so much for the better, for the better.
right. Because we're all changing diet, getting more sleep, and learning
Mhm.
strategies at the same time together. And it's a good thing. It's a good
It
thing.
is.
Well, Dr. Vanatta, thank you so much for your time today. We are so thankful to talk to you again, and we appreciate all you do for the community.
Yeah, of course. It was great, great talking about a subject that I'm really passionate about. And if anyone is looking for a new pediatrician, I'm here on 56th Street in Bell in Scottsdale. And again, this is one of my passions. So yeah, come check us out.
That's great. And we will definitely put your contact
Yeah,
information so that people can find you.
great.
Thank
I
you.
appreciate it. Yeah, of course.